Hi, I'm Rick Lovett. In the early 1990s, I had what is called RK surgery. It was 16 cuts in my eye. I got to the point I could not see even the big letter on the screen, the E. And so I started looking for doctors. I went to 5 different doctors, and they all told me I would have to have a cornea transplant. And then on YouTube, as I was searching, I found Dr. Gulani, Gulani, in Jacksonville, Florida. I called him, talked with him personally, and he started looking at my case. He was able to get my eye to where I can see, and I am getting better every day. I highly recommend him to you. He's a very personal doctor. He calls me to make sure everything's going right almost on a weekly basis. And I just recommend him to you if you need something corrected with your vision.
Video, right? Ready? So Rick, as you can see in your eye, there are 16 cuts RK. Got it?
Got it.
That's what makes your vision very poor. It fluctuates, you have scars, and that's the situation that you were facing. Today you're here for your post-op. We did a laser corneoplasty on it.
Right.
How do you feel?
Feel great. Feel great.
I see your vision has come nearly to 2022, and you had asked me about how we correct RK issues. So I will explain that to you in a minute. Right now, first of all, how was the surgery for you? Any pain during the surgery?
Pain. I've had no pain at all. No pain.
Okay, great. So here we have these kind of cases. So if you see this, Rick, this is the cut section of an eyeball. Okay.
Gotcha.
Your cornea had all these RK cuts in it.
Right.
You get me?
I got you.
They're like about 95% deep. So
Right.
they're very deep each.
Right.
And the cuts are like landmines on your cornea. So, and the rest of the tissues you have your lens inside over here, correct? And the rest is pretty normal. But how I correct RK is depending on your age and presentation. If you have a scar from RK, I first peel the scar away using a laser.
Right.
Correct?
Right.
And make you see.
So,
Second, just having the RK flattens your cornea and makes it kind of abnormal and astigmatism.
sure.
But with the laser, I can shape that with laser corneoplasty without cutting,
Okay.
not LASIK.
Gotcha.
Smoothen it with the laser and make
Right.
you see.
Right.
And if you're of a certain age where your lens has become cloudy, then I will remove the lens first, which is like a cataract surgery, through your RK cornea. Replace that with an artificial lens, which is uniquely prescribed to your vision to correct your farsighted and astigmatism.
Right.
And leave the RK cornea as is without a transplant.
Okay.
Additionally, in these cases, you can still come back and do laser after the cataract to shape your RK cornea to a perfect basketball.
Okay.
So there are no limits of what can be done for an RK patient, and there is absolutely the fact that you guys can be corrected like you to 20/20 vision.
Right. Right.
Any questions, Rick?
No, that's pretty explanatory right there. Very good. Very good.
Any other questions you had today in your post-op you had wanted to ask me, share what I do and stuff like that?
No, I just wish everybody could find you.
Oh, thank you. But you saw patients like you here. They had come from all over, even on your surgery day when you were here.
Sure.
And I think most surgeons are capable of doing this. I just feel the mindset has to change among doctors that they look at these cuts and they go, it's impossible. I don't think so. The fact that you can see through the cuts means you still have potential.
Sure. Sure.
That's it.
Sure. Sure. Now,
All right.
that was about 5 minutes.
Enjoy.